All right, welcome everyone. Thank you so much for joining us for this webinar tonight, Fostering Purpose in Lewy Body Dementia and Parkinson's, Clinical Strategies with LSVT Big and LSVT Loud. For those of you that don't know, this is Lewy Body Dementia Awareness Month, and my name's Julia Wood. I'm the Director of Professional and Community Education for the Lewy Body Dementia Association, and I'm also certification and training faculty for LSVT Big. So let's go ahead and get started. It would help if my slides would advance. There we go. So you'll notice here that I'm an occupational therapist and I'll be one of your presenters tonight. My co-presenter tonight is Dr. Jessica Galgana, who will be coming on later, and I'll let her introduce herself. And she is faculty for LSVT Loud and also is the CEO of Open Line Speech and Communication. So we're going to really try to hit all the high points with that interprofessional care as well tonight. So thank you so much for joining me, Dr. Galgano. All right, so our biographies are here. I'm not going to take time to read all of this to you, but I think that the best thing to know is that Jessica and I are both very dedicated to education in all of these topics surrounding really quality of life and support of individuals living with Parkinson's disease and also those associated dementias. And so you can take some time to read about us there. All right, so then our disclosures, it's important to note that we are both consultants for and receive lecture honorarium from LSVT Global. So your microphones are muted. You'll notice this is a webinar. So you can ask questions by putting those in the Q&A function. At the end, we'll try to take some time to take some live questions if we can. You'll also notice that you have handouts, a link for that handout for the slides that you can download. That was emailed to you, and it should be in the chat as well. After, there's going to be a survey that comes up that you can take, and you're going to need to do that if you want to get those CEU credits for tonight's content. So here's some information about our speech language professionals who are reporting their CEs. So this is being offered for 0.1 CEUs. So you'll notice that you have to watch this 1 hour presentation, do the survey, and that's available for the live and on-demand webinar. It's a little late where I am. My brain's getting a little saucy, and you'll notice you can always, with any questions, email us webinars@lsvtglobal.com. All right. And then also those PTOTs can also claim for that credit as well. So here's our learning objectives for tonight. So upon conclusion of this webinar, we hope that you're going to be able to really define what we mean when we're talking about helping to support this concept of purpose in life for folks with Parkinson's and Lewy. We're going to summarize some of the scientific findings that support the role of purpose in brain health and dementia and even Parkinson's. We're going to identify ways that with LSVT Big and LSVT Loud, you can really support that engagement in those meaningful and purposeful activities for your clients to really drive that neuroplasticity, create that brain change, and help them really engage in what's meaningful to them. So I think that we all know that, both Parkinson's disease and Lewy body dementia, and important to note that when we talk about Lewy body dementia, this can often be really confusing. We're talking about Lewy body diseases. So that would be also your Parkinson's disease dementia. And so people that have had Parkinson's for at least a year, kind of those motor symptoms first. And then we know that for some people, around 50 to 80% of people with Parkinson's, they may go on to develop Parkinson's disease dementia if they live long enough with the disease. And then it also includes dementia with Lewy body. So those are those folks that have the cognitive changes or the dementia first or at the same time as those motor changes. And so we know that whether it's Parkinson's we're talking about with even those mild or subjective cognitive changes, even early on, or more down the spectrum, those changes with dementia, it's not just the motor symptoms of these conditions. These cognitive challenges really make it more difficult. And so we're talking about motor, right? Where that's that slow movement, the stiffness. A lot of times with the dementia, they're more prone to falls as well, that postural instability, and even those speech changes may be more pronounced. And then those cognitive fluctuations are such a hallmark and so difficult even for us engaging in therapy, right? 1 minute they can seem very alert, the next minute they can seem really kind of fogged out. Hallucinations are quite common. These are often of people or animals. They can be visual, auditory, tactile. They're most often visual. And, we just did our first group the other day, an OT colleague and I, at LBDA for people with Lewy. And apathy, such a problem. And this is so overlooked, so misunderstood, right? We think they should just snap out of it, but we're talking about changes in the brain that are really driving that lack of interest, that lack of motivation, difficulty with attention, so that engaging in even things they might enjoy becomes more arduous. And so all of these things combined really causes a reduced participation in not just activities of daily living or things that someone has to do, but also their hobbies, social interaction, the stigma around dementia and cognitive change, and even some of these motor changes. And then also self-care. So that can be impacted as well. So, what do we mean by purpose? That term gets thrown around a lot. And this article or these articles really talked about purpose as involving having a set of goals and intentions for the future that contribute to a sense that life is meaningful. So it's not just those day to day doldrums that we think about, but engaging maybe with family, with friends, maybe gardening or golfing or going to your book club. And to have a clear and meaningful direction in life, that is really going to be based upon what someone's values, right? What you are motivated by and what you enjoy may be way different than what that would be for me. And then our goals and our passions really drive that as well. And so they also talked about how it means to act intentionally, deliberately. So pursuing what really matters to you and contributing to the world in a positive way. And so I also love this one too. When we think about the idea of living with purpose or what gives us purpose, it's really unlocking our story. And I found that so often with my patients, my clients throughout the years, was really learning who they were, what their gifts were, what they're curious about, what had they explored, but maybe what were they so interested in. And there's expanding evidence that suggests that. I even just found an article tonight, a little too late for this presentation, but that had come out about aging and purpose. And they're really calling this a psychological resource for aging well. So as we're thinking about a lot of our clients, none of us are getting younger for sure, but a lot of our clients, we're talking about Parkinson's and Lewy body dementia, are in that aging space. And so how can we help them continue to do things that are meaningful? So the science really suggests that purpose and meaning in life is associated with a reduced risk of cognitive impairment. Now, this was not specific to Lewy or Parkinson's. I want to be clear. This was just thinking overall. Also, mild cognitive impairment and dementia. And so, research is really suggesting that it might contribute to our cognitive reserve. So, what the authors were thinking about here is when we think about depression, inflammation, and dementia, it might be that purpose or meaning in life could play a protective role for the brain. We talk about exercise, right? And brain protection. But this, having this sense of meaning and drive and goal oriented behavior really may help protect us from that neuroinflammation and cellular stress response. So, something else to think about. And so there's a growing body of evidence that really suggests that it helps to play a part in psychological resilience when we're engaging in purposeful activities. So it helps people to overcome or recover quickly when they're having a challenge to their health, like Parkinson's, or their well being. There's more research suggesting that having that sense of purpose is associated with positive cognitive outcomes in older adulthood. So, for all of us on this call, not just thinking about our patients, but I think also thinking of our own brains, they see better cognitive performance and resilience to dementia related pathology. So, this is such an important thing to be thinking of, not just what ADL or IDL task, but how can we really support meaningful engagement? And then in Australia, they did a study. They found that there was those with a higher sense of purpose outperformed their peers on measures of memory and processing speed, and they had reduced rates of decline for processing speed over time. And you think about that with Lewy and Parkinson's, right? That processing speed is such a big part of those cognitive changes that we see. So, in a nutshell, just to kind of sum all of this up, purposeful older adults tend to report better subjective health. They're at lower risk for stroke and dementia, and they live longer relative to their counterparts with a lower sense of purpose. So, we have so much we can do, right? As OTs, as PTs, as speech language pathologists, of helping our clients get in the kitchen with their grandkids and continue to bake cookies or do whatever is really meaningful and motivating to them. So, what can we do then, right? Well, I think number one, through LSVT big, through LSVT loud, through that supportive therapeutic relationship, we can promote that sense of control, really helping that individual gain a sense of empowerment to do the things that they want and need to do. And we're going to do this by helping them engage in activities that they're interested in, right? So we might have to dig in there a little bit, especially if that apathy is going on. We've got to try to find out maybe what were past goals or interests so that we can help align some activities and try to find something that's meaningful and relevant to that individual. A lot of times people want to find a way to contribute to community. So maybe fostering support groups or having group sessions. When I, in my clinic prior to the pandemic, I had a cognitive fitness group and we did a book club once a month. And some of those groups can really, really create such a bond between people, helping people find opportunities to volunteer. I found some great ways for a lot of my clients and patients to contribute in schools around here and local charities, and it gave them such a sense of purpose as well. And then ultimately, I mean, we're all doing this, right? We're helping them adapt to those health limitations. So we want to include each other and work together as a team and bring in those social workers. A lot of times they're going to need more support, maybe family counseling, maybe resources for how to age in place or look at placement options. And then ultimately, we've got to make sure we know from all the research we're seeing, we have to help people maintain social engagement. So important that they're getting out and seeing peers, enjoying themselves, having that social time. And then so much for dementia or cognitive change, or even when we think about the unpredictability of like Parkinson's symptoms with the medications waxing and waning. Utilizing a consistent schedule or routine comes up so often in really helping people build and cultivate and support that sense of purpose. So when we talk about meaningful activities and we're talking about purpose, what does that mean? Well, number one, it should be enjoyable, right? I think that sometimes we forget this as therapists. We're really looking at what maybe is going to drive that, fine motor coordination or get that heart rate up. But we also want to think about what does the person enjoy, and then we have to, of course, think about it being suited to the individual skills and abilities, but also their preferences. So, what do they like to do? What brings them joy? What gives them a sense of meaning? How can you connect them to something maybe that they've forgotten about? And then it needs to be related to personally relevant goals. So finding something that the individual is motivated to do, they need a reason to get in there and participate, especially if they've got that apathy going on. And then it has to be engaging. So we make sure that we're giving our clients activities that are more than them just being physically present, right? We got to show up with their whole self. So when we look at LSVT big and LSVT loud, it's maybe task around golfing or gardening and practicing those tasks and really bringing our affect into it and finding those things that drive and motivate that individual. And these activities are really going to help that individual express and also reinforce their identity. And we know that a lot of times they're really struggling to hold on to that, especially if there's cognitive challenges going on that are, hitting them at the core of who they believe they are. And then what are the factors around them engaging in the activity? Where can we support? Where can we help them, find new opportunities to get out there and engage in that activity, maybe in a community or group setting? And then we want to look at things that promote that sense of identity too. So we're expressing it, we're reinforcing it, but what helps them maybe find pieces that they don't even know are there, maybe reconnecting to their spiritual self or different aspects of their community. And then looking that they're getting adequate both cognitive and physical activities. So we want to make sure that their brain and their body are both being stimulated. And to do this, though, we've got to really think about what activities and what resources are available. And post, pandemic, when so many exercise groups and programs and things started online, I think that as therapists, we're remiss if we don't have a nice, long, robust list of all these things that people can find, both in our community, hopefully in person, but then also virtually if needed. All right. So then looking at Parkinson's disease, and this article looked at engagement and well-being and the link between the two. So they interviewed people here and they found that well-being was really measured by what people did. So they wanted a sense of independence, they wanted a sense of satisfaction. And that a lot of times was linked with feeling like they were a contributor. So they were useful to others in some way. They were able to contribute and be of service to someone else. And so I think we want to watch a lot of times, especially as people are advancing with Parkinson's, right, or with Lewy body dementia, where everybody starts to want to help and do everything for them. And it's out of love, it's out of kindness, it's out of a good place. But are we still allowing that person to be a contributor? And how can we support them in contributing? And they found here that participants recognized that Parkinson's limited what they could do. So they recognized, okay, what I can do is less, but they found value in accepting that limitation. And they were proud of achieving what they felt like they could. And so they found here that their physical, their mental, and also their environmental health was considered in what they thought of with their well being. So around occupation, when we think of like relationships and identity, people had different meanings. So they had, meaningful engagement was necessary for facilitating and kind of maintaining these relationships. And then that sense of identity was often wrapped up in that sense of engagement. So they felt they were human when they could participate in things that were meaningful. And they found here too that activity engagement was really necessary for well-being. So if people couldn't engage in the things that they wanted to do, then that started to really impact well-being. And so the researchers here felt that major illness didn't have as much of a negative impact on that sense of well-being if people could maintain engagement and activities they enjoyed and if they had social support. So I think two factors right there as therapists that we can really support and help with. And, we hear this all the time. When I joined the Lewy Body Dementia Association, I should say prior to that, I was an occupational therapist at the University of Pennsylvania's Parkinson's Disease and Movement Disorder Center for many years. And we trained people and did therapy with people all the time with Lewy body dementia, Parkinson's disease dementia. And I was shocked when I joined LBDA and some of the doctors would say, wow, you worked with patients with Lewy. I send my patients to therapy all the time and they won't even evaluate them because they say they can't make any progress. And I was so floored. And I think as therapists, we have to really move away from this concept that if someone has cognitive decline, they're not able to participate in therapy. Now, am I saying that every single person with dementia can participate in therapy? No, it's an individual basis, of course. But a lot of times if we focus on this person-centered goal setting, they found that even patients here that in this case it was subjective, I can't talk tonight, cognitive impairment, they set three goals and they rank them from what was not important to extremely important. And you'll notice the different types of goals here that people noted. There was, symptom and cognition management, but time management, technology use, leisure, home management, friendships, volunteering, care of others. So don't think that people with cognitive decline can't think of a goal and can't think of something they want to do. And it's important to remember the differences for folks with Lewy body dementia. More challenges to attention, visuospatial function, executive function, less about that amnestic memory. So not like Alzheimer's at all. So don't think if you've had patients with Alzheimer's, you feel like couldn't remember or couldn't do therapy. We might have to train the care partner. We might have to wrap some supports around, but they can often participate in therapy and get a lot from it. So don't not try at least. So that purposeful living really goes beyond diagnosis, right? With therapy, we want to help people reconnect with their identity and support that autonomy. We want to build routines for them that are around this meaningful engagement. So thinking about what brings that person joy, what would they love to do? And then, when we support that caregiver communication, we help reduce isolation. And so we really help to support that engagement with the community, reduce the care partner impact, empower that couple to live more successfully and have better quality of life. So, why are we all here? How do LSVT big exercises help with all of this, right? Well, we know that with Parkinson's and with Lewy, the amplitude of their gross and their fine motor movements have stopped, so are impaired. And so this can impact doing things in the kitchen, making, a meal with family, going out and gardening, shopping. A lot of times difficulty with their mobility to start movement with that freezing of gait, or maybe even stopping movement. They might have fascination, which can be really, really dangerous. Those direction changes. So, working with the exercises is going to help with all of these mobility issues to help someone engage in what they love more. We know that endurance, balance, and strength are all supported by doing these exercises. And then they're working on range of motion and posture as well. So, they kind of get a lot of bang for their buck and hit a lot of birds with one stone here. But the goal, even though the exercises are doing all these great physical things, right, with balance and strength, ultimately we're trying to generalize it to those functional activities, right? What is meaningful to that person? I love to keep my patients reading. This was always a big one for me. How could I keep them reading? And then also being able to reach up on that bookshelf and get that book. So then the loud exercises, right? These are going to help increase the amplitude of their movements needed for speaking. It helps ease their starting and their initiation of their voice. We know that vocal volume and that endurance to support that can be impaired. And then speech, breathing, and clarity is something that often people need to work on. But it's beyond just the speech and the breath and the voice, right? We know the facial expression becomes impacted. That's that spread of effects we see, that improved intonation, and then just confidence with communicating. And that goes so far with supporting engagement in social activities. Because if they feel like no one listens to them and they're not heard, they're probably not going to want to interact socially very much. So the goal with LSVT Loud too, they're trying to generalize to those functional activities in daily life, and they're using that loud to facilitate the improved loudness. But it's not the end goal of therapy, right? The end goal is that communication and engagement that Jessica is going to tell you all about. And so our treatment session, when we're looking at LSVT big, right, we've got our exercises on one side. We talked about that link, but then we get into these functional components, things that someone needs to do every day. Then we're also going to take it further and go to those hierarchy exercises where it might be those bigger goals of playing golf, doing a hobby. We're going to build that up across the 4 weeks, always working on mobility, always giving that homework so they're getting that practice at home, and then looking at those carryover exercises so that we're linking all of that amplitude into their day-to-day life. And we know that ultimately these core amplitude rescaling exercises are going to link back to function, and then they're going to translate that amplitude into those personalized, salient individual goals for that specific patient. And with that, I'm going to hand it over to Jessica.
Thank you so
Welcome, Dr. Galgano.
wonderful. Thank you so much. Um, so this actually, Julia, I couldn't have predicted this more perfectly. You left it off really talking about how we link those daily exercises to function. And what we're going to see in the next slide is really more information about when we talk about linking these exercises to function, we're really talking about translation. And what we see is um, that if within every task that we practice, whether it's LSVT big or LSVT loud, we see it has a purpose beyond the therapy room, beyond that specific exercise. The amplitude-based movements, the vocal exercises, these are tools that are going to help individuals relearn what normal feels like, how much effort it truly takes for them to move or speak effectively in daily life. So when we have someone practice stepping, with gait or stepping over or into something. Really what we're doing is it's not just repetition. This is practice for life. It's to be able to step into the shower, step onto the elevator, get off of the train, etc. So we want all of these improved movements, whether we're practicing with PT or OT or voices, if we're practicing with speech pathologists, to really show up when someone is stepping into the car, when they're reaching on for the shelf, when they're greeting their neighbor, or when they're talking with the doctor. It's really that bridge from clinic to community where we're going to see all of that change happen. And so within both LSVT Big and LSVT Loud programs, we have functional component tasks and functional hierarchies that are really drive to design or designed to drive over or generalization. So we start by identifying repetitive, meaningful daily tasks. These are going to hold the personal value for patients and occur frequently. In LSVT Loud, what patients are doing, they're overlearning those commonly used and salient phrases in daily exercises. In LSVT Big, they're doing simple functional movements to facilitate that carryover. And they're really aiming to bring that amplitude rescaling into daily living and really allow for patients to be constantly reminded to use those bigger movements or louder voice outside of the therapy room. So we want to practice those intentionally. We want to do it with amplitude so they become automatic. We want to encourage that accuracy, that compliance with home exercise and carryover exercises so that people know that when they're practicing these movements or those ahs hundreds of times, they're not just exercising. They are reclaiming their independence and their confidence to do those things that make up their day and make it meaningful. So let's take a look now at two video examples. Um, we are going to see that on the left, you're going to see, and actually in both videos, we'll see certain skills broken up into subtasks. And within LSVT Big, also in LSVT Loud, but these videos will show LSVT Big, you're going to see that we can break the skills up into subtasks so that each step ultimately becomes this nice therapeutic opportunity to move big, to recalibrate effort, to connect with moving on purpose. And so what you're really doing is transforming the routine task or exercise into a moment of self-efficacy and participation. So Julie, if you could play that video on the left, you're going to see a person with early Parkinson's, more so affected in the left hand. And let's take a look. She's a manager at CBS.
Ready? Yep. Go. Big left. Left. Left hand. Yes! Left hand. Good. And stop. Good.
Excellent. So this was an exercise because this particular woman was a manager at CBS and she had to pull a large chain on a pulley every day to lift and lower a garage door. And so you can see how the functional exercise would really impact her day-to-day activities of daily living. So let's take a look at the video on the left.
With your left hand, okay? Pull, 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 pull. Now with these cards, every time you pull, I want you to say out loud that word.
Okay, what it is on the card.
What it is on the card.
All right.
Ready?
Yep.
And go.
Etching.
Big.
Alternatives. Memories.
Keep it going.
Memories.
Big.
Alternatives.
Pull.
Memories.
Pull.
Alternatives.
Louder.
Memories.
Bigger.
Memories.
Go for it.
Alternatives.
Pull it.
Valuables.
Pull it.
Etchings.
Excellent. So you also know, and as a manager, she had to be able to count money. Note the therapist's clever simulations. She had great modeling. She really drove those tasks to really push that effort and to allow for that function.
With your
So in LSVT Big, we see that the functional component tasks really consist of 1 to 3 specific goals that you obtain through discussion, through observation, through something called a functional task recording form for those of you who are already certified, and stay tuned because there's more to come. But you'll see that these are very complex activities that involve multiple steps, and that are all always grounded in function, or in especially individualized or salient function. And these are a part of every single session. And so those repetitions that are conducted over time, when patients are practicing these movements so many times, again, they're not just exercising, they're reclaiming their independence, they're reclaiming their confidence in doing those things that they want to be able to do every day. So, because we live in a multitasking world, we really need to train that way as well. And you saw that a little bit in the videos that we just viewed. Once the foundation is strong, we layer in things like problem solving or conversation or other movements to be able to challenge that system. So maybe the patient is practicing in LSVT loud, it might be speaking loudly while walking or doing a simple household task. What you see here are perfect examples of meal preparation. And this is something that many people want to be able to continue doing, but maybe they've grown hesitant about it. So you can see that in therapy, you can break this down into the subtasks: retrieving ingredients, gathering tools, stirring, placing food in the oven, and serving. Each step becoming a therapeutic opportunity to move big. Again, recalibrating to those new effort levels that are needed to be able to do these same things they've been doing all of their life, but that with the presence of Lewy body or Parkinson's, now more effort is needed. So they've got to recalibrate to those new effort levels needed to be able to move with normal amplitude and really connect movement with purpose. Again, what we're really doing is transforming a routine task into a moment of self-efficacy and participation. And you'll see that in LSVT Loud, we do something similar. And in the first part of the LSVT Loud program for speech, we're doing something similar through these functional phrases. And these functional phrases are short, meaningful expressions that people use every day. They are overlearned, they are personalized, they are important to the individual. So these phrases are practiced repetitively. What we're doing is we're bringing that loudness we've obtained with the ahs and the highs and lows, those discrete rescaling exercises into daily life. So these phrases act as reminders to help patients remember to use the loud voice and speech at home. They're really serving as what we call calibration hooks. Again, reminders. So when a person who practices that phrase, "How are you?" with the therapist several times each day in therapy with that nice loud voice that results in clarity and intelligible speech that doesn't need to be repeated, when they go out there and they connect with someone at CVS, let's say, and they're paying or they're greeting someone and they use that phrase, if they don't use that loud voice, but they've practiced it with great effort and loudness with you, that should serve to help them remember, oh, wait, I didn't use that loud voice the way I did with Julia in session, the way I did with Jessica in session. Let me try that again. Or, wow, I did that just the same way I practiced. So let's take a look at this in function in this next video here.
We're going to do them in Amharic now, too.
Okay.
All right, so look at the piece of paper if you need them. But we're going to start with Ishituruno.
Ishituruno.
Nice, that was loud. That was sounding really good. When you're loud, it sounds so clear. Everybody's going to be able to hear you and know what you're saying.
Okay.
Try it again. Next one. We're going to say Buna Tatalo.
Bunata talo.
Nice. That was nice and clear. You have beautiful Amharic. Next one, you're going to do Wuatatalo.
Bunata talo.
Yes. Nice loud voice. All right, this one's my favorite one. You ready? Anunkasakasalo.
And kisakisalo.
Yes. Nice job. And need.
And need.
Good. All right, here we go. Up next is Course Anubla.
Kursanura.
Very nice. And then Mesa Anubla.
Misanura.
You're sounding nice and loud. That is a good loud voice. All right, here we go. Arfalo.
Arfando.
Perfect. Nice loud voice on that, Maza. Shintibit Hedalo.
Shintibitirando.
Good. Nice loud voice, Maza. Terragina Lesh.
Tirajinalish.
Yes. We're going to do
Okay. Adorable. And so you can see that those functional phrases that are practiced are short, meaningful expressions that people say every day. Again, they don't change, but they do progress in difficulty over time. They're practiced with loudness, with amplitude, with clarity, with intention over and over. So people will naturally carry these over into their daily interactions. So over time, we add that cognitive load. We add that emotional challenge, like speaking while moving or speaking while counting or doing something at the same time to simulate real life. Again, that goal is strong, confident voice that becomes second nature. And so what we're going to see also is that there's another place within the LSVT loud treatment session, and that's within the second half of the treatment session where we're really linking those loud ah and high and low exercises to function. And we do that within the functional speech hierarchy tasks. The functional speech hierarchy tasks really allow one to systematically progress to that desired functional speech level. So if it's conversation, it's conversation. And what we do with these exercises is that they get longer and more complex as the weeks go on in therapy. What we're doing here is we're building a person's ability to stay loud for longer periods of time with that nice clear speech, to reduce frustration by using different reading materials session to session and using different speaking topics and formats that will change daily and are personalized so they are salient or meaningful and important to that person we are working with. Again, as Julia mentioned earlier, what we're doing within LSVT Loud is the same thing that we're doing within LSVT Big. We're bringing that amplitude rescaling. In this case, it's for the voice within LSVT Loud that will impact breathing and speech and so many other things. We bring it into speech during the entire second half of each treatment session. And again, we're working towards that client's individual long-term functional communication goals over time. So what we're going to see in the next video example is a woman working with the client using eLoud. This is the application of LSVT Loud over telepractice, similar to the video we just showed a moment ago with functional phrases. And this man is doing some hierarchy practice at the sentence level, which would be week 2 in LSVT Loud.
I'm going to make you do this one because I want you to stay loud for all of it. If you start to get soft and fast, I'm going to stop you. So say again, 1 to screw it in.
1 to screw it in, and 1 to observe how the light bulb itself symbolizes a single incandescent beacon of subjective reality in another world of endless.
And we're stopping and think loud in
another world of endless absurdity reaching out towards the more than cosmos of nothingness.
All right, let's listen to that.
In another world of endless absurdity reaching out towards the more than cosmos of nothingness.
What about your voice?
Oh, my voice?
Yeah.
It's pretty decent.
Let's
Great. So we can see here that the LSVT loud exercises, as I just mentioned, they progress in difficulty every week. We can add challenges over time, and we do all of these things because we want application to the real world. We want to really drive these neuroplastic changes as a result of the activity that we're doing. So when we're thinking about the exercises and or the hierarchy or functional component tasks we're doing within LSVT Big, we want to think about these as daily assignments that we are mandating to really use bigger movements in real life situations outside of the therapy room. And the purpose is really, I'm sorry, these are carryover exercises we're talking about. So, carryover exercises are really where patients prove to themselves that what they're learning in therapy works in daily life. So, what we do is we assign small but specific challenges. Like, I want you to use your big movements when you are cutting your food tonight, or reach big when you grab for your coat. Then the next day, what we do is we discuss what they noticed and how it felt. So this accountability really builds awareness and reinforces that their new amplitude is both normal and effective. So similarly in LSVT Loud, carryover assignments bring the voice into real situations. Patients might call a family member, order at a restaurant, or speak up in a group. So these daily experiences will help them recalibrate their perception of loudness and realize that what might feel too loud actually is perceived as very typical to others. The difficulty of these assignments does progress and becomes more challenging across the 4 weeks of treatment. And like LSVT Big and LSVT Loud, these exercises are specifically, and we do hold our clients accountable for doing them. They are also given to patients every one of the 30 days of a month. It's also part of a client's homework. And so these are really aimed to be empowering. Every successful interaction will then strengthen a person's confidence and self-trust. So now let's think a little bit about the how and the why of these carryover exercises, and think about the reason why we do them. In Parkinson's especially, but also with Lewy body dementia, there is typically a mismatch between the online perception of how loud the voice is or how big or in what way a person is moving, and the output as well as how others perceive it. So people think they're moving typically, they're walking normally. Everyone else is just walking a little bit faster. In LSVT Loud, people will say, I'm not too soft. I'm not too quiet. Maybe you're losing your hearing. And so people tend to perceive themselves as too small, too soft. Actually, if we could just go back to that slide for 1 sec, Julia, sorry. They'll perceive themselves as too soft, slow, or small, and then they'll think, oh gosh, I can't speak like this. I'm too big, I'm too loud, I'm shouting, I'm moving in a weird way. And so these carryover exercises that we design and we have them do every single day from day one will slowly start to convince them and help them trust you and really know for themselves that what feels too big or what feels too loud is actually moving with typical movement amplitude and using a typical loudness of voice. Now, we also make sure that our carryover exercises, the functional exercises we design, they're always personalized, they're always purposeful, and we are making sure people are practicing their exercises or doing this exercise every single day. You're going to see that how you design these exercises is based on the needs and the goals of their client. And this can be related to OT, PT, or speech pathology needs. But no matter what, we want to design exercises that are personalized and salient to each individual because we want to capitalize on that principle of neuroplasticity, which is saliency. And if something is meaningful or important to someone, it's going to make a bigger difference at the level of the cortex, which will then, of course, impact permanent change. Now, purposeful practice is also about identity, right? It's not just about how a person moves or how they speak. It's also, about who they are while they're doing it. And so we want, when a person has Parkinson's or Lewy body dementia, and they're involved in therapy, we want them to reconnect with meaningful roles. As Julia was saying, they need to feel purposeful, whether it was as a parent, as a friend, as a cook, or whatever it is they do. So we want to make sure they are practicing rewarding tasks that are important to them, that are emotionally salient, because it's really these activities that will activate the basal ganglia circuitry, make them important, make sure that the program exercises are linking to their functional goals, that they're incorporating their hobbies and their passions and even things that they've stopped doing. So they're feeling better about themselves and starting to improve or improve their participation in life more easily. So they're using tasks that are very important to them, that are client-centered throughout treatment. And this will also indirectly help to address feelings of depression or apathy that is so common in both of these populations. Now, we target amplitude. I want to talk a little bit about why specificity matters so much in Parkinson's and Lewy body dementia. They're really the foundation of neuroplastic change. We're not just doing random exercise. We're doing that highly targeted, repetitive practice at the right intensity. Each LSVT session is going to include hundreds of repetition, really focusing on that target of amplitude, whether it's loudness in the voice or the motor speech system or bigness in the entire across the movement or motor systems. We're really building consistent effort to automaticity. It's the consistency targeting this amplitude throughout the entire body that is going to reteach the brain what normal amplitude feels and sounds like. And an effort or repetition is essential. What we see in the next slide with regard to repetition is that it's really the key to learning. Both LSVT Big and LSVT Loud have maximal daily exercises. These really allow the patient to engage in constant, repetitive, high effort, overlearned exercises. In LSVT Big, we have those multi-directional sustained movements and repetitive movements, as well as the functional component movements that are very patient-driven. And you can see here how many thousands of repetitions a person is doing in a month within this program. Similarly, they're doing a lot of repetitions within LSVT Loud with those maximum sustained vowel phonation tasks, the maximum phonational frequency range exercises, our 10 functional phrases, and then in both of the programs, really focusing on bringing that loudness, those bigger amplitude movement patterns into functional hierarchy, which is reading and conversation, into those functional component movement tasks, as well as reinforcing and stabilizing those behaviors and bringing it into function for better participation and well-being by doing homework every day and those daily exercises, carryover exercises, again, that are patient-driven, that are variable every day, that are progressive in nature and make sense in terms of what week you're targeting exercise at the level of the hierarchy, but still really drive that high effort no matter what anybody is practicing. And so really what we're doing with these carryover exercises is that we're using real life really digging into each individual person's life to design tasks that will make an impact. We want them to be able to think and talk and move when they're in the kitchen, when they're gardening, during any of their activities of daily living, including shopping, of course, a good one. I had to throw that in there. No matter what, that's involving or that will result in improved life participation. And importantly, throughout our sessions, whether we're doing LSVT loud or we're doing LSVT big, we always have to think about calibration. Calibration is really what is going to allow these gains to last. Patients learn to recognize that the extra effort they feel is what normal movement and speech require. Once the awareness clicks, they can self-monitor and self-correct outside therapy. And so we have to be careful to teach calibration from day one and really talk about the importance from day one about lifelong maintenance, ongoing exercise that will allow us to maintain our social connections and participate in life and sustain these skills over time. And so we can also encourage this nice lifelong model of care for our clients as well. Of course, they can start by doing LSVT loud or LSVT big with us, as long as we are a certified therapist. That takes 1 month. But what is 1 month in the journey of Parkinson's or Lewy body dementia? It is not that long at all. And so we need to make sure that when patients are finished with our 1 month program, that they are very careful about continuing with their daily home exercise, 15, 20 minutes a day, that they are involving themselves in group exercise programs as they desire, thinking about LSVT loud for life or big for life, and that they're coming in for tune-ups when they need. And so if they, frequently people might have a medical situation or fall, and that will, result in a setback or some regression. And that doesn't mean anything but the need for a possible refresher session or a tune-up. And so those checkups once in a while, with short doses of treatment every so often, I think are really beneficial. Right now, you see on the slide here, we recommend every 3 to 12 months. I would say 12-month check-ins are fine if we've got individuals, for example, or who are at early stages, Honen-Yar 1, 2, and it's really just check-ins with maintenance. But for individuals who are at Honen-Yar 3 or later or more advanced stages of Lewy body, sometimes even checking in with people as early as 1 month can be helpful. So in terms of the key takeaways, purpose, as always, which is referring to a sense of direction in life towards goal-directed activities. This is really at the heart of what we do. Purpose is going to promote resilience in the face of these challenges to well-being that our patients with Parkinson's and Lewy body have. They may be modifiable, these programs, with some short intervention, and so those are really speaking to those refresher sessions that if people are regressing, they can come and reach out to you. You can reassess and just help them get recalibrated, get back onto their daily exercise program, or maybe they need a few refresher sessions with you to get back up and kind of into their flow. And just keeping in mind that research is suggesting, and more research is coming out that shows that having this sense of purpose can reduce the risk of cognitive impairment or mild cognitive impairment or dementia. It can contribute to cognitive reserve, as Julie was mentioning before. It can improve our cognitive performance even in the presence of disease and promote resilience to dementia-related neuropathologies. So I'm going to leave you with some references to look at for your review if you are interested. And fortunately, we have a little over 5 minutes to answer any questions that you're going to have. So before we break for QA, I want to tell you a couple more things and remind you how you can ask your questions. So if you do have a question, if you haven't been doing so already, you can type your question in the chat box in the control panel. You can also raise your hand. We'll unmute your mic to allow you to ask and have the discussion with us just live. And of course, if you prefer or think of something later, you can always email us at info@lsvtglobal.com. After this webinar, there will be a survey. And so for those of you who are observing this webinar live with us this evening or this morning, depending on where you're joining us from, you're going to see the survey display for you on the screen directly after the webinar. We'll also email it to you one day after the webinar. And for those of you who are watching on demand, you'll have a survey link sent to you, and it'll also be shown here in this webinar. It is required that you complete it to be able to receive your certificate, but it's quick. It takes 5 minutes or less to complete. And so we do appreciate you completing it. We do pay very close attention to your responses. We aim to make these webinar topics or flows more specific to your needs with that feedback. So thank you in advance. For those of you who don't know, LSVT Global has also launched a podcast called Think Big and Loud. And so this is really all about sharing inspiring stories, expert insights, and engaging conversations, really all designed to empower and uplift. We cover a wide range of topics from the latest in therapy techniques to personal journeys of triumph and resilience. And you can see that on our YouTube channel. So on the next slide, you'll see some more information about the website and where you can email if you have questions. Again, on the final slide, just reminders about how you ask questions if you have forgotten. And what we're going to do now is go ahead. Thank you, Julia. Let's see if I can find my video. Here I am. Hi. All right. So we are ready for questions. Thank you so much for participating with us today. Julie, did we have any questions come in?
Looks like we've got one in the Q&A here of how to react or redirect a client who's hallucinating that there's extra people around the table. This can be really difficult. Love to hear what Jessica has as ideas too. You know, a lot of times we have to just kind of redirect out of that environment if possible. So it might be that we need to maybe sit in a different space to eat. Also, too, though, you always want to consider, are the people threatening or upsetting? I've had a lot of patients that saw little children or little people, and they weren't upset by them. And actually, often they can have insight into the fact that I know they're not really there, but I feel like I see this person. So I think number one, you always want to ask is it threatening? Is it upsetting to the individual? If not, then I've had many a conversation about a good hallucination with a patient as far as what the person looked like or what they were wearing, or but then I think too, if it is upsetting, maybe thinking of moving to a different environment, maybe changing the lighting. Sometimes if there's shadows and stuff, that can really make those hallucinations a little bit more. But I think really first start with, do you need to do anything if it's not upsetting? Anything to add, Jessica?
You know, just everything you've said, Julia, is so perfect. And it really is so individually or context specific. You know, I think just to reiterate what you're saying, what I first typically do, I'll stay calm, I'll be reassuring, I'll speak in a softer or gentler voice. I usually assure that if it's appropriate, that I'm here to help them feel comfortable and feel safe. And regardless, no matter what, I don't argue with them about the hallucinations, because this can definitely increase confusion or anxiety. And then I'll just gently redirect or distract them to try to redirect attention to something else. And so sometimes you can just acknowledge or validate what they're seeing, and then maybe ask about a different interest or something else that you're thinking about. Or maybe it's a music artist, a book, an activity you enjoy, kind of suggesting kind of that that redirection in that way. Or you might suggest an activity, kind of, or even some movement. Why don't we get up and take a walk? Let's take a drink, or maybe looking at a photo album, or introducing something that's familiar, that feels comfortable, but it also redirects attention and distracts in nature. As Julia was saying, I think asking questions can be helpful too, as long as they are not distressed by the hallucination, asking them about it, right? It's like, what are the people at the table doing? And as Julia was just saying, it can help us better understand what's happening in the mind and kind of figure out whether they need reassurance or further distraction. I think also maybe a couple extra little things, keeping the environment calm. Julia, you were kind of speaking to it. Bright lights, busy environments sometimes can increase hallucinations. So reducing sensory overload, maybe dimming the lights or moving to a quieter space can sometimes help, though brightness sometimes also is better. Offering physical comfort to some, touching a hand, offering a comfort gesture for some, not all. It can soothe anxiety. Touch can be very grounding for people who are experiencing confusion, but be mindful of those who may have had traumatic experiences. And then a couple other things, like, doesn't help in the moment, but thinking about medication adjustments, like once you've gotten out of that situation, talking with your medical team and family if hallucinations are becoming frequent, may be necessary to consult the team and kind of figure out, especially the dopamine agonists that can cause hallucinations, if something needs to be adjusted there. And then overall, just making sure if you do have a patient who's experiencing those things, talking with the team, their care team, about a calm routine, like a predictable routine to minimize confusion, really reduce or try to reduce hallucinations. Keeping that environment consistent and familiar really creates a sense of security, which can help keep those hallucinations at bay. So I didn't really say anything different than you, Julia, but I think just to reiterate what you said, all those I think are kind of good ways to deal with it in the moment and try to deal with it as a happening occurrence, like a regular occurrence.
Absolutely. Absolutely. Good tips. Thank you. Looks like we had another one come in that says, any suggestions for improving homework compliance with someone that cognitively has a hard time remembering, but has a spouse or caregiver who is not interested in performing the homework with them?
Oh,
Yeah, it's a tough one.
poor people. It is a tough one. So this is where, at least with the way that we are able to function and where I practice, because we're private, so we can be in the office with an individual, we can go into the home, we can do things online. What we'll typically do for that type of individual, we've got minimal care partner support, a person's got some cognitive decline, they're having trouble with a routine. We're lucky in LSVT Loud, we have something called the Coach, and it's a software program that's super easy to install. I'm sorry, Julia. Big doesn't have one, but it's got a calibrated mic, and there's a client version. So it'll walk a person through. They just have to press start. It has a mic that is attached to the computer. We go in, we set it up for somebody, and they press start. We usually have a little station. It's their exercise station. They come in, they sit, they press start. Nobody touches that station at the house, and they use the Coach. That's just one example, but for LSVT Loud certified clinicians, I would say using the Coach or putting it into the routine. So if you know their morning routine, I had a man who he did his morning routine. He was still working. He'd drive to work, he'd park. That's where he did his exercises every day. Obviously, that person is not cognitively impaired, though. So one of my people who's more cognitively impaired, I might, if they have an aid, Or if they have a place where they sit regularly, I would make it I would do my best to either have the aide or the care partner just this one time help me set up the homework station. So we have the paperwork with the home exercises, the reading material, whatever we need, or the coach. And so care partner only has to help us set it up. And then that person just has to get to the station to do it. So again, what I think I'm speaking to is really getting to know your clients, figuring out like where can you get in there? Where can you just get that little bit of help to so you can set it up to make that person as independent and as empowered as possible. You do your best with those kinds of situations. Julie, I don't know if you have other pearls of
The
wisdom.
only two I could think of. So we had a really similar situation. The wife didn't want to help, and they had a grandchild that lived close by that was interested in becoming like a personal trainer or something. And so the grandkid started coming into the sessions, and so he could learn to do the exercises with the grandfather. And so that worked out really well. Not always a scenario, but I think if you can find even maybe a somebody going to school to be a therapy aide or
That's
anything like that.
exactly what I was just thinking of. I
Yeah.
think there are so many therapists in school right now. And if you can then reach out to an OT, a PT, an SLP department and say, hey, my patient is in need of a care partner. Is there a student who's interested in volunteering who has experience with big or loud who might be able to help? Because that even just having that kind of anchor for 15 minutes a day or a person to remind something like that, I think is a great idea.
And another had a homework station similar to what you're talking to. So the cousin would set up, they had a room because they just had an extra room in their home where they had the video set up and it was playing all the time. So she would go in at whatever point it was at and she knew how to restart, but she also sometimes would just start going with it. So I think there's a lot of different ways you can do that. But yeah, that can be a challenge for sure. Great question. Great question. I think we had one more question maybe to take if you have a few minutes, Jessica. Patients coming into therapy without their hearing aids. So how do you address that in your treatment? I'm going to let you do that with loud, especially.
Yes, yes. Okay, so first of all, we can't force a person to come in with the hearing aids. I mean, ideally, the best thing is wear the hearing aids. They are so important, especially when you educate your patients about the importance of a hearing discrimination for memory, for being able to maintain our cognitive skills. But I won't go on that soapbox right now. If they forget their aids, I would say one solution would be with the people who are forgetting often, see if your receptionist, volunteer, or you yourself send a quick email to the family, set up an automatic email reminder, make a quick phone call, text, whatever it is. Hey, don't forget your hearing aids. So making sure that they're wearing them for your session. That being said, we want them to be worn all day. I mean, they need them all day. And so, I think just coaching to the best of your ability to get them to wear them is, I think, your best bet, and getting care partners and loved ones involved. But if they forget it, no matter what, here is the takeaway, whether you're an SLP, a PT, or an OT, if they forget the aids, you need to make your voice deeper. You need to articulate very clearly. And so when you're communicating with an individual who has a sensory neural hearing loss, this type of communication will be much better heard and understood. If you just get louder and you have a high pitch and you're speaking just as quickly, you're still not going to be so intelligible. It's the vowels of speech that are low frequency sounds. Those sound waves travel a long way. And they hold the power of speech. Consonant sounds hold only 5% power, but 95% intelligibility. So and with sensory neural hearing loss, people lose the high frequencies. So they lose most of the consonants, not the vowels. So if you just make your voice louder, it's loud noise. You know what I mean? It's not clarity. But if you decrease your pitch and you speak in a deeper voice, number one, that's better and easier for people to hear. Number two, if you can think big in that mouth. Use a nice, clear speech pattern. Typically, loudness, as we know, results in a spreading of effect to improved articulation. So be loud and clear with a deep, or be a big mouth, kind of clear voice with a deep pitch, and you will be heard and understood much more easily. So if it's that, that's your technique to do it. But of course, you
Great tips.
wear their hearing aids.
Great tips. Thank you. One quick question I think that you can answer here. Do you have to be LSVT certified to purchase the coach as a clinician? She used to be LSVT certified, but the certification expired.
Yes. And so the answer is yes. What's great though is that even if your certification has lapsed, it's a quick and very inexpensive recertification that I think you'll love. We get such rave feedback about it. And so I would recommend go ahead, get recertified. There's so much great new research to learn about too. You'll have updates about the techniques, any changes to the therapy based on the research. And then of course you can purchase the coach. If you end it, I think you can also sign up for the full course if you felt like taking it again. And then I think you get a big discount on the coach. But take a look at the website, you'll be able to see.
Excellent. Thank you so much. I always learn something when I present with you. That
Oh,
was
it's
really
great to
interesting.
present with you, Julia. Always. I think
Awesome.
the same.
Absolutely. Well, you guys, everybody, thank you so much for showing up. Thank you, Jessica, for helping in the background. Thank you, Jessica, for being here to present. That was a lot of fun. Please go learn more about Lewy body dementia this month. Build that awareness, teach your clients, teach your communities. And thank you again for your time tonight. We appreciate you all. All right. Bye.
Yeah.